Jel uspjela? Počinjemo.
Da. Okay, I think we are now live. And thank you, Jessica, so much for joining us at the Art Colony Tribe that is focused on air pollution in Serbia and the Balkans and in general. And Jessica comes to us from the Institute of Life System Analysis in Austria, near Vienna. And I'm so happy and so honored that you will talk to us about the health and air pollution and this connection, because this is an aspect that is super, super important. Thank you so much.
No problem, and thank you very much for the invitation. So, as Vesela said, my name's Jessica Slater. I'm a research scientist at a research institute called IASA, and my research really focuses on looking at the health impacts of air pollution and the potential benefits from various policies related to improving air quality, but then also looking at some of the other co-benefits which can come from mitigating or reducing air pollution, such as for climate change, but also for sustainable development. So I'm going to just give a bit of a brief introduction about air pollution and the health impacts of air pollution, and then a little bit about what I know so far as well in Serbia, based on various reports that have been written. And hopefully then it can facilitate some discussion, and maybe we'll all learn something. Okay, so I don't know whether you've already had some information and had some talks on this subject, but first of all, I guess, is to understand what air pollution is. And air pollution is anything that contaminates the outdoor or indoor air, as defined by the World Health Organization. And you may see either in the news or in various reports lots of different types of air pollution. The most common one that we talk about when we refer to health is PM 2.5, and that's often what's monitored and reported on in terms of trying to keep below certain air quality guidelines. So PM 2.5 is basically particulate matter that is smaller than 2.5 microns. And this is important. So the size of the particulate is important because at this size, it's been found that that these particulates can enter through the lungs, through the alveoli, into the bloodstream, and then be transported around the body to cause various health impacts, which I'll get into sooner. Particulate matter can be either directly released into the atmosphere, directly emitted to the atmosphere through normally combustion activities, so through burning often of biomass or burning of fossil fuels. But it can also be formed within the atmosphere through various chemical reactions of different pollutant gases. So you may have also heard of some of these gases in the blue, such as nitrogen oxides. Often a common source of those is traffic. Ammonia often comes from agriculture or from fertilizer use. Sulfur dioxide often from power generation and from coal burning, and then volatile organic compounds, and ozone and carbon monoxide, also various different sources. And so what happens in the atmosphere is that we get these compounds, these gases reacting together and condensing to form particulate matter. So when we talk about some of these gases, some of them have direct health impacts, such as ozone and nitrogen oxides, but often we're interested in reducing the emissions of these because they also form this particulate matter, which is the key pollutant when we're thinking of health. So the major sources of air pollution are very varied, and they'll very much depend on the location that people are living in, as well as at the time of year. But you probably know quite a lot of these sources. You know, the main ones are transport, so emissions directly from vehicles, but also from road dust suspension from the road. We've got emissions coming from agriculture, such as from livestock, from rice, which produces methane, and often, depending on the country or the location, you might get agricultural residue, leftovers of the crop. I know quite saw air pollution in Serbia, and this depends. So sometimes it's due to heating, so combustion of maybe coal or biomass for heating, and then often in several countries that I work with, also from cooking. We've got emissions from industry directly from the products and the processes that are involved, and then also from combustion for energy. From waste, we've got in some areas specifically a lot of waste burning, but then also we get emissions from decomposing waste. And then finally, again, this is another big source, I think, in Serbia of air pollution is power generation, specifically power plants, fossil fuel power plants. So one of the main reasons that we care about air pollution is because of its impact on health. So globally, the World Health Organization estimated that 6.7 million deaths were attributed to air pollution exposure, making it the largest environmental risk factor and the fourth largest overall risk factor for premature mortality globally. And we know from various different epidemiological studies now that there are multiple impacts of air pollution exposure. And these range from impacting respiratory disease, respiratory infections, things like lung cancer, also increased risk of cardiovascular disease. It has been linked also recently to diseases such as dementia and Parkinson's. It's been linked to increases in asthma and allergic reactions, as well as diabetes. And exposure for women when they're pregnant has also been highly linked to the increased risk of having a child which is born preterm, so prematurely, and also having a child who will be a lower birth weight. Mm-hmm. And so we know from various studies over the past 20 or 30 years, we know that there are links between air pollution exposure and various health endpoints. I don't want to spend too much on this slide because it's a bit complicated, but this is the kind of work that I do, where we look at trying to understand how different air pollution policies could impact health. So we look at various different policies and scenarios in the future. We relate these to how it will change the concentration of PM2.5. So, for example, if we wanted to look in Serbia and we wanted to say, okay, well, by 2030 or by 2050, all power generation will be renewable energy, for example. We can look then at how that changes our emissions and our concentrations of our particulate matter. And then based on various studies which link the concentration of exposure to various health endpoints, we can understand the changes in health impact, the changes in premature mortality. So for various diseases, these are the 6 that we normally look at, just because the quantification of the increased risk is quite well known and quite well documented. But you can also look at various other indicators not related to premature mortality, such as asthma or hospital admissions for various different diseases as well. I don't want to go into too much into that because it might be a bit complicated. And then just finally, well, not finally, but just one more thing to say, I guess, on air pollution and health exposure. And I was trying to find a better figure I had from this. This comes from the Global Burden of Disease study, which quantifies the health impacts of air pollution for almost every country around the world. And we can see that this is percent of total deaths, so the percentage of deaths which are due to air pollution. And you can just see that there's a really large spatial variety in the health impacts of air pollution exposure. And the point I try and make here is that this varies also within a country and within different population groups, and it's often those who are the most vulnerable or the highest vulnerable groups in society who will have the largest health burden due to air pollution exposure. And this might be because of underlying health conditions, but it also might be due to them being more likely to be exposed because of the places that they live. Even within a city, there are some areas which are more polluted than others, or potentially because of the occupation that they do. We did a study on understanding the inequalities of air pollution exposure for people in different occupations as well. So just to say that air pollution is very much a global problem, especially it's important to tackle these kind of issues at a regional level, but there is significant spatial variety. So just moving on a little bit from health before I probably go back to health, and you may have already, people may have already spoken about this during this session, but just to say that air pollution and climate change, as well as various other environmental issues, are explicitly very linked. So they're linked in multiple ways. Often the sources of air pollution and the sources of greenhouse gas emissions are the same. So, for example, power generation, coal-fired power plants produce greenhouse gases, and they also produce air pollution. So policies which tackle those areas will have benefits for both air pollution and climate change. There are also multiple pollutants which we call short-lived climate pollutants, and this is an area that I work on quite a lot. And these pollutants contribute both to air pollution and have health impacts of air pollution, but also to climate change directly. So if we think about things in a more holistic way, it's likely that we'll have multiple benefits for air pollution and climate change. And also here it's mentioned crop yield loss, and there's also impacts on ecosystems from air pollution as well. And through reducing, so there's an organization called the Climate and Clean Air Coalition, which do a lot of work in this area, and they look at how tackling both air pollution and climate change through reducing these short-lived climate pollutants could have multiple benefits at the same time. Without having to have any further action, we can have multiple benefits for both air pollution and climate change. And so, for example, by a study by Van Dijk et al. In 2018, found that if all countries met their targets or met their targets to keep global warming below 2 degrees by 2050, there could also be 1 million premature deaths avoided from reducing air pollution exposure. So not even looking at specific air pollution policies, but only looking at climate policies which could keep warming to below 2 degrees, could save 1 million premature deaths from climate change.
Wow.
And there are also multiple other impacts of air pollution for sustainable development, or multiple benefits which could be achieved from policies which also reduce could be having access to energy. I think poverty is a big thing. Could have clean energy, which would reduce air pollution, greenhouse gases. It would also help meet out of poverty and so on. So just to say, I guess with that, benefits which can be achieved also in reducing pollution. And I've done a few slides now just on pollution in Serbia. I haven't personally worked in in Serbia. We did work at one point in looking at air pollution in Bosnia, but just to, I guess, bring things into context, and you probably know more about this than me, and you may have already been talked about to this, but just some key facts about air pollution in Serbia in terms of health. And yeah, I apologize if you already know this, but more than 50% of Serbia's population are living in areas where the annual PM2.5 levels are 5 times higher than the World Health Organization guidelines. The World Health Organization recently updated in 2021 its air quality guidelines, reduced from 10 micrograms per meter cubed to 5 micrograms per meter cubed. This is kind of how we measure PM2.5 in terms of concentrations. And these guidelines are considered a safe level. There is no real safe level in terms of air pollution exposure, but for the protection of human health, it was decided that 5 micrograms per meter cubed. Whereas the 2022 average PM2.5 concentration in Serbia was around 25 micrograms per meter cubed, so about 5 times higher than that. And we can even see within, speaking again about this, this disparity in air pollution exposure, we can see quite clearly on this map of Europe and the Middle East and Northern Africa that in this kind of Western Europe area, you've got quite lower, and Northern Europe and Scandinavia, much lower levels of PM2.5 compared to the Balkan states and Southeastern Europe as well. So the death rate from air pollution exposure in Serbia is among the highest actually in Europe, and it accounted for over 10% of total deaths. So the Global Burden of Disease study quantifies the health impacts of air pollution exposure and quantifies the number of deaths which are considered to be due to air pollution exposure. About 2,700 in 2019 in Serbia, making it the, I think, 7th highest risk factor for premature mortality.
Sorry,
and if we look.
Sorry, we just lost that number when you said there was a glitch and we didn't hear the number.
It's almost, so it's the 7th highest risk factor for premature mortality, air pollution exposure in Serbia, and estimated to be study can understand what percentage of those deaths are due to different diseases. So, for example, 23% of total deaths due to chronic obstructive pulmonary disease due to 20% of deaths from AIDS, 16% of ischemic heart disease, 9% deaths from lung cancer, and 9% of neonatal deaths were estimated to be due to air pollution exposure in 2019. So it's clear that it's air pollution is a global health problem, and it's a key health problem in Serbia and also in the rest of the Balkans. The major sources of air pollution in Serbia, and again, these vary very much so within different locations, and this is just taken from a report by the State of Global Air on Serbia, which estimated that at the national level, on average, it will be different for different cities. The largest source of the health impacts of air pollution from PM2.5 exposure come from coal power generation, which actually accounted for 68% of electricity generated in Serbia in 2019. Another big source of air pollution and of the health impacts of air pollution is residential combustion, primarily, I think, from residential heating, and then transportation. is also a source, and these other sources, agriculture, waste, and industry, will also play a role. Different, depending on the area they're looking at, depending on. Agriculture,
Sorry,
a large resource. Yeah, but I said this varies by different time. There's large spatial variation in pollution concentration. Some of this is due to differences in emissions, and some of it's different to weather, also
Ja, baš bez veze, mnogo je dobro predavanje.
Možda imam mrežni kabel, ne može ide na Wi-Fi. Ako ja ne znam sad da se javi da koriste mrežni kabel ili su samo na Wi-Fi.
Ne, baš mi je žao, tako
Ali
divno
trebalo
predavanje.
bi da na mrežnom bude bolje. To je super.
Da, da.